Good morning. In the last 7 days, more than 113,000 Iowans were tested, and the state reported more than 16,600 new cases with a statewide average positivity rate of 14.7%. And while these numbers are not where we need them to be, they are lower than they were the week prior, when nearly 28,000 new cases and a positivity rate of more than 24% was reported. Currently, younger adults aged 18 to 29 account for most of the new positive cases, 20% overall, but cases do remain fairly evenly spread amongst most age groups. Over the last few days, we've also seen a decrease in the overall number of Iowans hospitalized due to COVID-19, with the exception of yesterday with a slight increase, where a slight increase was reported. 1 week ago, on November 17th, we reached our peak of hospitalizations at 1,527, and in the 5 days that followed, we saw day-to-day decreases of as many as 76 patients in 1 day. And again, while these are positive signs, it's too early to know if they're indicators of a trend. Several national models are now forecasting the number of new cases and hospitalizations predicted in the United States and by state over the next 4 weeks. Most do predict an increase, but of varying degrees. The models make various assumptions about the levels of mitigation and other interventions which may not reflect recent changes in behavior. I want to reassure Iowans that no matter what's reported, in Iowa, we are monitoring the situation every day in real time. We're studying the data, we're talking with the leaders of our health systems and our hospitals, we're reaching out to long-term care facilities, and we're discussing additional steps that may need to be taken to keep our most vulnerable safe. And I'm asking you to have that same focus. Concentrate on what you can do now and over the next 4 weeks to stop the spread, and we know that each of us can make a difference in slowing the spread of COVID-19. The increase in positive cases over the last several weeks has also resulted in increased usage of PPE among hospitals, long-term care facilities, and other healthcare providers. But thanks to months of procurement and ongoing inventory monitoring and management, Iowa's PPE stockpile is strong. Here to provide an update is Jake Nicholson, a Response Division Administrator at Homeland Security Emergency and Management. Jake?
Thank you, Governor Reynolds. As the Governor mentioned, I'm here to brief you on measures the state has taken to ensure continued access to much-needed personal protective equipment, or PPE, to protect those working on the front lines of this pandemic. This fall, our resource management team at the state EOC analyzed trends in our statewide usage rates and monitored shortages in the supply chain. As a result of our efforts to build the state stockpile over the past 9 months, we believe we're well positioned to meet the need for months to come. Over the last 3 weeks, with the increase in positive cases, we've seen a significant increase in usage rates for PPE, specifically for items such as gloves and disposable gowns. Even taking into account these increased usage rates, we have over 16 months supply of gloves and over 18 months supply of disposable gowns remaining in our stockpile. Additionally, we have executed contracts with suppliers for these high demand items, with resupply shipments scheduled to be delivered to our warehouse every month for the next 7 months. Building and maintaining a large stockpile of supplies alone cannot meet the need of Iowans and our frontline pandemic responders, however. Since March, the state EOC has worked tirelessly to distribute PPE and supplies. We could not have done this without the dedication and commitment of many state and local partners. Our resource management team, in partnership with the warehouse team at the Iowa Department of Public Health, has worked every day since March, processing requests for PPE, pulling those items from our warehouses, and coordinating their delivery. As of this week, the state has completed 2,557 deliveries of PPE and other necessary supplies, totaling 15.7 million individual items. These deliveries have included items large and small, from advanced life-saving medical equipment, such as ventilators, down to the tissues Iowans used to blow their nose before being tested at one of the state-operated Test Iowa sites. Most recently, we worked in partnership with the County Emergency Management Coordinators from Butler, Cherokee, Lynn, Mahaska, Polk, Pottawatomie, and Union counties to establish 7 PPE hubs, or nodes, across the state. These nodes will supply county emergency management coordinators and county EOCs across the state with PPE needed to address supply shortages at local hospitals, long-term care facilities, nursing homes, and other healthcare providers responding to the pandemic. These nodes will be resupplied by the state's stockpile to ensure frontline pandemic responders have the supplies they need now and in the months to come. From the very beginning of the state's pandemic response, our hospitals, long-term care facilities, and other healthcare providers have been requesting state PPE and supplies through their county emergency management coordinators when they experience shortages. We believe our latest distribution model will enable those facilities to have requests filled more rapidly than ever before. I want to thank all state and local partners for contributing to the success of the mission to supply PPE across the state. As Governor Reynolds has said, there is still much work to be done, and at the State EOC, we stand ready to serve the citizens of Iowa and support our communities. Thank you.
Thank you, Jake. And I also want to recognize Homeland Security, County Emergency Manager, coordinators, and everyone at the state and local level who have worked together to ensure our state stockpile remains strong and that critical supplies get to where they're needed quickly and efficiently. The availability of a COVID-19 vaccine will be a significant step forward for our nation and our state. Vaccines will reduce COVID-related illnesses, hospitalizations, and deaths, and further advance our overall recovery to the pandemic. Last week, Pfizer applied for an emergency use authorization of its COVID-19 vaccine from the FDA. Moderna is expected to do the same in the coming days. And just yesterday, it was announced that a third vaccine from AstraZeneca is just as effective as the others. If approved for emergency use, vaccines will be fast-tracked for distribution nationwide, which could mean vaccinations begin just weeks from now. Yesterday, we heard from the Trump administration about plans to get vaccines to state as soon as they are approved. They anticipate 22.5 million doses of the Pfizer vaccine and 15 million doses of the Moderna vaccine will be distributed immediately and allocated by state population. Whenever the decisions regarding approval are made and distribution begins, Iowa is ready. The Iowa Department of Public Health has developed a vaccination strategy in coordination with a wide range of public and private sector partners, including public health, emergency management agencies, healthcare organizations, industry groups that include critical infrastructure sectors, policymakers, and community vaccination providers. Iowa's vaccination strategy addresses allocation, distribution, transportation, dispensing, and administration of state-allocated COVID-19 vaccines. The strategy is based on the availability of the vaccines and the distribution occurring through existing infrastructure. At first, there will be limited supply of the COVID-19 vaccine, so our immediate vaccination efforts will focus on those critical to the response, including those who provide direct care and maintain critical infrastructure, and those of highest risk for developing serious illness from the virus. Prioritization of populations while the vaccine supply is limited is being considered by the Advisory Council on Immunization Practices and the National Academy of Medicine. In addition to their recommendations, the Iowa Department of Public Health and Dr. Pedati will also consider CDC guidelines and work with various stakeholders to implement a targeted approach for COVID-19 vaccination. Some details of the plan, of course, will be contingent upon additional information that won't be available until the FDA approves emergency authorization for vaccines. So those details include things like the number of doses that will be initially allocated to our state, which will guide prioritization of populations and the immunization requirements of the specific vaccine. Once those details are known, the Iowa Department of Public Health will finalize the strategy and prepare to begin distribution of the vaccine. As we move towards Thanksgiving, the impending vaccine brings with it the hope that life will return to normal soon. However, it will take some time for the vaccine to become widely available. And in the meantime, we must be patient and continue to do everything that we can to prevent getting and spreading the virus. And that's especially important this week as we prepare to celebrate Thanksgiving and the official start of the holiday season. As we saw during the summer months, holidays can result in a spike of virus activity and new cases, something that we cannot risk at this time, and I still believe that together we can keep the numbers trending in the right direction.